Okay, let's dive into this. Imagine for a second, 1 minute, you're seeing completely fine. The next, poof, sudden painless vision loss in just one eye.
Yeah, it's not like things just get blurry. It's often described, like a curtain suddenly coming down.
And that usually means the blood supply to the eye has just been blocked, cut off.
Precisely. And when that happens, we're basically talking about a stroke, but happening inside the eye. The medical term is central retinal artery occlusion, CRAO.
Right.
But calling it an eye stroke really gets the point across. This is serious, a real medical emergency.
Just like a stroke in the brain then. Needs that same urgent response.
Absolutely. It demands immediate, urgent attention. The clock starts ticking right away.
And it's not just about trying to save the sight in that eye, is it? I mean, that's huge, obviously, but...
No, you're right. It's also a massive warning sign. Like a flare going up, it signals there could be a blockage or, some other dangerous issue lurking elsewhere in your body.
Something that could cause another stroke. Maybe even a more devastating one.
Exactly. Which is why the response has to be so fast and thorough.
So the material we're looking at today, it's a recent medical protocol, right? A kind of roadmap for doctors.
Yeah, it's a really important guide, helps doctors and hospitals know exactly how to handle these eye stroke situations, focusing on speed and coordination.
Okay. So our mission here is to unpack that roadmap. We want to understand the absolutely critical steps, why every second counts, and what the whole process looks like. Well, for you, the patient, or maybe someone you're looking after.
Makes sense.
So where do they even start? What's the very first thing that happens?
It really begins with confirming what's going on. An eye doctor needs to take a look right into the back of your eye.
At the retina?
Yes, looking at the retina, checking the blood vessels there to actually see if that main artery or maybe one of its branches is blocked. That visual check is what locks in the eye stroke's diagnosis.
Okay, so they confirm it. But while that's happening, or maybe even before, are there quick things they can try, like right there at the bedside?
Oh, definitely. There are some immediate things they might attempt. Think of them as ways to maybe, just maybe, dislodge whatever's causing the blockage, or at least reduce the pressure inside the eye.
Like what?
Well, they might try a very gentle eye massage, or use certain eye drops, maybe even give medicine, specifically to lower that internal eye pressure. These are quick, sort of conservative first steps.
Trying to buy some time, maybe.
Potentially make a difference in those first crucial minutes, yeah.
Now, here's something that really jumped out from the protocol. The urgency gets even sharper, right? Especially for older people.
Yes, because an eye stroke, particularly in people over 50, can sometimes be caused by a specific kind of inflammation that attacks arteries. It's called giant cell arteritis, or GCA.
And they need to check for that immediately.
Immediately. It's critical. And here's the key part. If they even suspect GCA based on symptoms or a quick check, they don't wait for blood test results to come back.
They start treatment right away.
Right away. High-dose steroids, usually. Because that inflammation, if it is GCA, can spread incredibly fast and affect the other eye, too. It's like an emergency within the emergency.
Wow, okay, so you've got the diagnosis, maybe tried those immediate measures, check for GCA. Then what? Does it move towards treatments similar to brain strokes?
It often does. The protocol talks about potential more advanced treatments to try and restore that blood flow. But these decisions are made very carefully, often bringing in brain stroke specialists.
Makes sense.
So if you get to the hospital really quickly, generally within about 4.5 hours since symptoms started, one option might be clot-busting medicine given through a vein.
Like TPA, the kind they use for brain strokes.
Exactly like that. But, and this is a really strict rule in the protocol, before any clot buster is given, you absolutely must have a quick brain scan.
Why is that?
To make totally sure there's no bleeding already happening in the brain or, another stroke occurring at the same time. It's a crucial safety step. If you do get the medicine, it's done under very close monitoring.
Intensive care, maybe?
Often, yes.
The protocol also mentions something else. Hyperbaric oxygen.
Right. Hyperbaric oxygen therapy. That involved breathing pure oxygen inside a special pressurized chamber.
How does that help?
The idea is to basically supersaturate your blood with oxygen. So much so that even the tiny bit of blood that might still be squeezing past the blockage carries enough oxygen to potentially help the retina survive longer.
And that's an option for longer, not just the first few hours.
It might be considered even if you arrive within 24 hours, sometimes even later, depending on the situation.
Okay, so while all these urgent treatment options are being considered or even started, there's another track running in parallel, right? Figuring out why it happened.
Absolutely essential. You have to find the source of the blockage, the original culprit, to stop it happening again, either in the eye or elsewhere.
So how do they hunt for that?
Well, they'll often start with an ultrasound of the big arteries in your neck, the carotids, looking for significant plaque or blockages there that might have broken off and traveled to the eye.
And if the neck arteries look okay,
Then the search usually moves to the heart. They'll use detailed heart scans, like an echocardiogram, and monitor your heart rhythm closely, sometimes for a full day or two.
looking for what? Irregular heartbeats.
Exactly. Like atrial fibrillation, which can cause small clots to form in the heart that can then travel anywhere, including the eye.
And blood tests too, I assume.
Oh yeah, comprehensive blood tests, checking the usual suspects like cholesterol, blood sugar, but also sometimes looking for less common clotting disorders, especially if the patient is younger or if the neck and heart checks don't show anything obvious.
Right. So once they find the likely cause, or even if they don't find a definite one but have suspicions,
Then the protocol really emphasizes getting aggressive with prevention, starting medications to prevent future clots or blockages.
it's like blood thinners,
Yeah,
aspirin.
often medications that target platelets, like aspirin or similar drugs. And almost always, powerful cholesterol-lowering drugs, statins usually, often started regardless of what your initial cholesterol level was. The evidence shows they help protect blood vessels.
Plus, tackling other risk factors head on.
Definitely. Getting high blood pressure under tight control, managing diabetes really well, providing support to quit smoking. It's a full court press on reducing overall cardiovascular risk.
It really sounds like a massive team effort.
It absolutely has to be. That's one of the strongest messages in this protocol. Eye doctors, neurologists, or stroke specialists, cardiologists, primary care doctors, they all need to work together.
Like a well-oiled machine.
Exactly. Getting tests done super fast, sharing results instantly, making joint decisions quickly. The protocol even outlines how to make sure patients get transferred or admitted to hospitals that can provide that level of coordinated care rapidly. It's complex.
So, wrapping this up, the main takeaway seems crystal clear.
Yeah, an eye stroke is a true emergency. Full stop.
It needs that immediate checkup, a quick look at urgent treatment options, that really fast hunt for the underlying cause.
And then aggressive steps to prevent it happening again. It's not just an eye event. It's a whole body warning. And it needs that whole team response. Saving sight is crucial, of course, but preventing a future, potentially worse, stroke is just as critical.
You know, thinking about how interconnected everything in our body is. What does the urgency around an eye stroke really tell us? Maybe about paying closer attention to any sudden weird changes we notice anywhere in our body.
That's a really powerful thought. It's a stark reminder, isn't it? A symptom that seems localized, just in one place, could actually be the very first signal flare for something much bigger going on under the surface. Worth paying attention to.